Hello, my name is Dr. Lori Bailey. I am the Psychiatric Mental Health Nurse Practitioner Program Chair at Franklin University School of Nursing. And this presentation is to explore the meaning and examples of microaggressions and to provide viewers with some strategies to help to mitigate the effects of microaggressions. Before we start, I'd like to kind of identify the purpose of this. Here at Franklin University School of Nursing, we are trying to create brave spaces. And this poem from the People's Supper really lays out what this means. Together, we will create brave space because there's no such thing as safe space. We exist in the real world. We all carry scars, and we've all caused wounds. In this space, we seek to turn down the volume of the outside world. We amplify voices that fight to be heard elsewhere. We call each other to more truth and love. We have the right to start somewhere and continue to grow. We have the responsibility to examine what we think we know. We will not be perfect. This space will not be perfect. It will not always be what we wish it to be, but it will be our brave space together, and we will work on it side by side. Why are we talking about microaggressions? And this is particular to students' experiences. When students don't feel seen or heard, stress increases, and stress hormones like cortisol cause executive function to be less effective, which means that learning really isn't occurring. Learning is a social activity. And in order for people to learn, relationships are really key. When microaggressions occur, it represents institutional betrayals and means that the organization fails to respond to discrimination. It contributes to a reduction in engagement, service use, and functioning. And the experiences cause students' achievement and academic persistence to decrease. May also lead to problems with increased attrition and dropout. And, in healthcare, we can't afford to lose any of our colleagues. So working to reduce microaggressions is really important for everybody. This video gives an example of a simple thing, a simple question or statement that can really have an impact on people.
When that question pops up, it's almost like, am I okay? Am I accepted?
I guess where I'm from, maybe most weeks, if not days.
Where are you really from? So, I thought I was from here, but now you're making me wonder if I really am from here.
You're asking me what city I grew up in, like what country I feel most at home in, where I was born.
I wish I could just say I'm from one place.
I can't get away from the fact that I'm black, so people see that and immediately I'm different.
Depending on who I'm talking to would depend on what answer they get.
Sometimes people ask me where you're from and I'll say anything from like London to like my mom's vagina.
People think I'm either a millionaire, a prince, or a terrorist. I'm none of them.
It's kind of like anything you tell them they're not going to be happy with because they're looking for the answer that's in their head, which is you ain't from here.
I was at a family holiday with my boyfriend's parents, and they had some old family friends that came over for dinner, and after a little while they were like, so what part of India do you originate from? Because from the way you dress, I'm thinking maybe you're from the northern desert. And I was thinking, well, I was brought up in Bradford. I'm wearing like a charity shop vintage dress. Where are you getting these like signifiers from?
Punjabi, British Asian. British Punjabi?
I don't know really. My dad was from Iran, my mum is from England. I was born in New York, came here when I was 6 years old.
I'm not fully British, nor do I want to be because I have a different heritage. So it's really good to be able to balance out these two sides and really create what you can from it.
My mum told me she's part Jewish the other day, so it's constantly changing. More recently, where are you really from? I realise people are just curious.
I think most people ask it because everyone's a bit socially awkward, and if they feel like there's an in to make some small talk, someone just grabs for that. It's sometimes a nice thing because they want to learn about you, they want to learn about your background.
Where your blood comes from is such a small portion of like what makes you who you are.
When I look at people, whether they're black, white, Asian, whatever, I see certain things in their makeup that look like me, you know? And then I wonder, like, we're not all really different.
So, what are microaggressions? Microaggressions are exchanges that can convey hostile, offensive, exclusionary, demeaning messages to people because of a social group membership. This happens most often to people from less powerful or stigmatized social groups. So there are 3 different types of microaggressions that we'll talk about today. The first are microassaults. Microassaults include making denigrating or insulting statements, using slurs or making racial jokes. This is what we typically consider more conscious or deliberate forms of microaggressions, and this resembles most closely traditional racist or homosexual or whichever kind of discriminatory behavior. This can be name-calling or the use of epithets, can be nonverbal. An example is a white woman on an elevator, for instance. A black man gets on and she clutches her purse a little more closely. Environmental things like signs, Nazi signs, posters or other visual displays. Things like telling a trans person that they can't use the restroom that matches their gender identity. They're shouting racial epithets. White parents not allowing their sons or daughters to date people who are not white. Building a southern border wall. Police unfairly targeting people of color when in fact they're not doing anything. Micro insults convey racist or stereotypical assumptions. Some of the examples of micro insults might be ascription of intelligence, assumption of criminality, assumption of immorality, or making judgments about whether or not somebody belongs. The video that we just watched, when somebody asks where a person of color is from, no, really, where are you from? They're making a judgment about whether or not this person belongs where they are. Ascription of intelligence, an example. I had a African-American colleague who presented a research proposal to the research chair of the school where I worked, and the chair said, did you come up with this on your own? This is really good. The assumption being that what she communicated was that perhaps this black woman wasn't capable of doing this work on her own. Things like, you don't seem gay. You're different from, you're really smart for a whatever kind of person you're talking to. Expressing fear of certain groups, right? When a white person crosses the street to avoid black folks, that's an assumption of criminality, right? We're showing that we're afraid for no other reason but that these people are black. Micro-invalidations are communications that ignore or invalidate the experience, lives, contributions, perceptions of a given group. For instance, Supreme Court ruling a while back that reversed some of the Voting Rights Act pre-certification requirements for states said that we lived in a post-racial society, which says that there is no racism anymore, which denies the experience of so many people. When we look at American history as it's currently taught, it leaves out so much of the other groups, Native Americans, African Americans, Hispanic Americans. The history of their contributions is often a side note, and this invalidates so much of what this nation is because of those particular people. Using the wrong pronouns for somebody who is LGBTQ, consistently doing so, is a micro-invalidation. So, some racial microaggressions that you may have seen perhaps in the news. Unjustified questioning by police or threats by police. I have a friend who's been pulled over more than once because he happens to drive a nice car in a predominantly white neighborhood. Receiving second-class health care. We know that African Americans, Native Americans, Hispanic Americans have very different health outcomes than white people. Unfair labor practices, considered less intelligent, having teachers discourage them from further education, or unfriendly neighbors who make life difficult for them because they happen to be not white. Gender expressions might include sexual objectification. We see that in every car magazine ever. The lady in the bikini sitting on the hood of a fancy car. Second-class citizenship or invisibility. Discussions about things like whether or not we are entitled to birth control. That's we don't even own our bodies in that case, right? Assumptions of inferiority. I am a builder. I build bookshelves, furniture, I drywall, I do all kinds of handy stuff. Every time I've ever walked into a Lowe's or Home Depot or Ace Hardware, some man questions my abilities. I actually had one man who was looking for a particular kind of saw for a project. And when I told him what I was doing and what I was looking for, he literally held it up over his head and said to me, "I'm not going to sell this to you. Your husband will be upset." And basically, what husband? And why are we assuming that I'm not doing this work? Denying the reality of sexism. When people say there is no gender pay gap, it actually belies actual science and data. The assumption of traditional gender roles. Same thing. When I'm in Lowe's or Home Depot with my boyfriend, they start talking to him when in fact I'm the one who's doing the work. He doesn't understand what I'm doing. He's learning, right? Denial of individual sexism. Environmental microaggressions. When you walk into someone's office and they have posters up on their wall, or the truck stickers that show the woman in silhouette nude. Sexist language. All gender microaggressions. LGBTQ microaggressions include discomfort with or disapproval of the LGBTQ experience. Like when somebody says that it's a lifestyle choice, or uses religion to say that it's, I hear people frequently say, an abomination. Endorsement of heteronormative or gender normative culture and behaviors. For instance, when your forms have only male or female options and no gender non-conforming options. Exoticization or denial that heterosexism or transphobia are a thing. You're telling people who are LGBTQIA+, that their experience is not real. So what do we do, right? What do we do to prevent these things from occurring from ourselves? And then we'll talk about some strategies when we witness or experience microaggressions. So the first thing that we have to recognize is that these things are normal instant responses. So you meet somebody, your brain starts a process called category activation. Tries to fit people that we meet into categories that are already defined in our heads, categories that society has helped to define for us. Race, gender, age, weight, height, all of these categories. If the person differs from us in any of these categories, the brain notices and registers it. It's an automatic process. We don't have any control, really. This happens instantly. Most of us aren't even aware. It's normal. It only becomes problematic when we get stuck on that difference and can't move past it. Getting stuck means we hyper-focus on that particular characteristic. And we say something about it that may come across as insensitive or hurtful, right? So we don't want to get stuck. We might start to feel anxious because we don't understand, or we don't want to say something to offend. This is our amygdala, our fear response, our anxiety related to these differences coming forward. Again, something that we may not even realize that's going on. And if we feel anxious enough, we may just start to avoid the discomfort or the person altogether. One of the things that we can do to help to mitigate this is to become more intentional. Start looking at pictures or paying close attention when we meet somebody new who is potentially different in some way from us. Notice what it is you notice. Do you notice the color of their skin right away? Do you notice their other differences? Notice what you see first, and then start to think about why. What is it about that thing, that characteristic that you notice? And why do you notice that first? What beliefs underlie what you're seeing? What assumptions is it that you're making, or that your brain leaps to without you realizing? And, you know, as we become more intentional, as we notice these things that we're seeing first, if we challenge ourselves, our assumptions, our beliefs, we start to recognize those stereotypes. We start to recognize those things for what they are, as not based in reality. You know, if you think about, you know, a stereotype about any group of people, it's not new. It's been around for generations. It's something that is woven, unfortunately, into the fabric of our communities. And this is where many of these microaggressions or biases that we carry come from. It's not something that we woke up one day and decided, gosh, I'm going to be biased against people who are black, brown, LGBTQ, what have you. These are unintentional. One example of ways that society affects functions and the experiences of people who are different would be the school to prison pipeline. We have a system for years, for hundreds of years, where black people were considered less than and more criminal or less intelligent. And this is built into our system in so many different ways. And when we put more police in schools that are predominantly black, and assume criminality, right? We end up with kids who are going from our schools to our prisons that it's, as young as preschoolers, we have kids who are treated as though they are more violent or less capable of civility. So how do we fix this? How do we fix microaggressions? We talked about how to recognize some of the things that we see with ourselves, but we have to go more. We have to recognize colorblindness doesn't work. When I say to somebody that I don't see your color, I see everybody equally, you're really denying that person's experiences, something that has a huge influence over their experience with society and institutions. It negates them, which is hurtful. People who are part of majority groups can go through a day without being reminded that a white person can spend the day without having to think about the fact that it's white and what that means for us. Somebody who's male doesn't experience what it's like, doesn't have to worry about what it's like to be female and what it means for us as we move through careers. People who are of underrepresented minority groups experience it every day, and it affects their interactions. So the first thing that we can do is believe them. It's hard because it's not something that we as white, straight, Christian, heterosexual, we don't experience those biases. So it can be so far outside of our experience that we may not be able to picture how this works. So it's important that we believe them. And imagine what it's like. So learn to empathize with this group. Imagine what it would be like to walk into a Lowe's and have someone literally say that they're not going to sell you something because you obviously don't know what you're doing. Right? Imagine what it would be like to be pulled over because you're a black man driving a nice car and for no other reason, really. You have to be a good listener. You have to really hear what somebody's telling you and try to imagine. You have to be vulnerable. You have to be willing to accept that your experience is not what everybody else has. And, ultimately, we have to strategize to be our best selves. One of the things that often happens when somebody says to us, do you realize that what you said may have been hurtful, is to be defensive. It's natural. It really is. It's not something that anybody's doing to try and be, intentionally hurtful. So instead of defending ourselves when this kind of thing occurs, what we ought to do is recognize the impact. Instead of saying, that is not what I meant, recognize that, I apologize that was hurtful. So separate the impact from the intention. So micro interventions that we can do, whether we're bystanders or targets, we can validate experiences, communicate the target's value as a person, value their identity, support them and reassure them they're not alone. The goals of microinterventions are to make the invisible visible, disarm the microaggression, educate the offender about the metacommunications that they potentially unintentionally sent, and then if needed, seek external support for these things. So, making the invisible visible. First thing you can do is ask clarifying questions. Did you mean to say, or rephrase, right? So what you're saying is, Do you really believe that all fill in the blank people are fill in the blank? Make the communication explicit. So call it out for what it is. Let's talk about how what you said or did might have been offensive. That remark was probably not okay. It was racist or a stereotype or what have you. That hasn't been my experience. I have seen this. Identify the impact, right? This is not about intention. It's identifying the impact and making that clear to somebody. Do you realize that when you said that, you likely hurt someone? I know that you meant that as a compliment, but it came across as. Broaden the trait. So when somebody talks about, one of the ones you hear all the time is, black on black crime. Do you realize that white people kill themselves in the same proportions, right? So we do the same thing in our group as what you're talking about happening in black communities. Or just something as, crimes are committed by people of all races. Another great strategy, if you happen to be the target, is to reverse what they said. I have a friend who happens to be Asian American, and she's often told, "You speak great English." She says, "Thanks, you speak excellent English too," which kind of takes somebody and kind of makes them realize how it sounds. Disarm the microaggression. We have to make this so that somebody realizes what they said. So express disagreement. That's not how I see this. I don't agree with that. Describe your values and set boundaries. I believe that respect and compassion are really important. And you can say something that shows more respect in the future. Describe what's happening. Ouch. Really? Right? So, interrupting. Nonverbal communication is also really important. I don't want to hear that punchline. Please stop and let's focus on what we need to get done. Remind people of the rules, right? For instance, at Franklin, we've got policies about things that we shouldn't be saying or doing, discrimination, biases, and remind people of those things. Educate the offender. Now, remember, we don't want to lose this person. We want to bring them in and help them to do better, be better. So the first thing that we should do is promote empathy. Have you thought about how it might feel if someone said to you, I know a lot of people who don't fit that stereotype. Can you think of other reasons for that behavior? Is there another way for us to look at this? Appeal to their values, right? People want to, they are good people. Most of the people who are doing these things are good people who don't realize what they said was hurtful. So I know that you believe in caring about others. So think about this, right? And then again, differentiate their intention and the impact that they had on the target. I know you mean well, but I know you meant to compliment. I'm sure that you meant this as a joke. So by coming at them from a perspective of, I don't think you realize, I know that you're a good person, and here's how we could do better, keeps them from becoming defensive and completely avoiding the target or the discussion in the future. Seek external intervention. There are going to be times where what you've experienced and the interventions that you try don't work, and it becomes a situation where things are potentially harmful. Report it to leadership. And, if you're a preceptor or a faculty member working with a student, talk with the student about what it is they want to do for the intervention. Take, for instance, a patient who's given permission for a student to see them and then sees a person of color or a transgender student come in and they say, well, not you. Talk with the student. What do they want to do in terms of intervening? Get therapy or counseling if you're a target of this on a regular basis. And if you're someone who's witnessing this, encourage the target to find support, friend, community, counseling, because these things, these behaviors occur to these populations all the time. I have a friend who described it as 1,000 tiny little cuts every day. And the science says that these kinds of things, these experiences, create increased risk for burnout, turnover, real psychological damage, and trauma. This is traumatizing. So I love this quote. It actually came from a surgeon. But I think it applies to so many different things. And when we're talking about bias and microaggressions and how we can do better, better is possible. It does not take genius. It takes diligence. It takes moral clarity. It takes ingenuity. And above all, it takes a willingness to try. And really, when we talk about bias and microaggressions and all of the different ways that we can make mistakes, that's what this is about. This is about how do we do better? How do we make the little changes that over time make such a tremendous difference? Here's some references in case you're interested in reading more. And I encourage all of you to do so. And also, I'm available, lori.bailey@franklin.edu. If you have questions or concerns or need advice, I may not have all the answers, but I can help you find someone who does. Thanks so much for your time. Thanks for thinking about these things, and thanks for working with our students.